Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always concern your physician or a qualified healthcare provider for personalized guidance.
All right, today we're going on a bit of a journey. We're going to demystify a pretty complex medical condition and, in the process, uncover a story of just incredible medical progress.
So, let me start by asking you a question. What if a tumor that doctors called benign, non-cancerous, could still pose a major threat to some of your most vital senses, like your hearing and your sense of balance?
Well, that's the strange reality for people with something called an acoustic neuroma. So let's dive in. We're going to explore this rare tumor, not just as a medical condition, but as this amazing story of innovation and progress.
Okay, so first things first, what is an acoustic neuroma? Let's get right to the heart of what's going on with this so-called tumor on the hearing nerve.
You might hear a couple of different names for it. The other big one is vestibular Schwannoma. But what it boils down to is this. It's a rare, benign tumor that grows on that critical nerve connecting your inner ear to your brain. And when I say rare, I mean it affects only about 1 in every 100,000 people. So not very common at all.
Here's probably the best way to picture it. Think of that nerve as a vital communication cable. It's carrying all the important signals for both your hearing and your sense of balance to your brain. This tumor, then, is like a slow-growing ball of static or interference right on that cable, messing up those crucial signals.
So, if you've got this interference on the line, how does it show up? How does this growing tumor actually make itself known? Let's talk about the telltale signs. Well, a lot of it really depends on the size of the tumor. You see, when it's still pretty small, the symptoms might be kind of subtle, maybe some hearing loss in just one ear, or that annoying ringing sound we call tinnitus. But as that tumor gets bigger, it can start pressing on other things in a very crowded space, leading to much more serious problems like facial weakness, numbness, or even trouble swallowing. All right, so once it's diagnosed, what are the options? For a long time, treatment has really followed 3 classic paths.
The first one is observation, or as it's often called, watch and wait. If the tumor is growing really slowly, especially in an older patient, sometimes the safest thing to do is just monitor it with MRIs and avoid the risks of a big intervention. Then there's radiation, specifically something called stereotactic radiosurgery, which uses these super focused beams of energy to zap the tumor and stop it from growing, all without a single cut. And finally, you have surgical resection, the most direct approach of just going in and taking the tumor out.
But here's the thing, that was the old way of thinking. Today, care has moved way beyond just those 3 options. The modern way to handle this is all about a team-based approach.
And I mean a whole team. It's not just one doctor making the call anymore. You've got neurosurgeons and ear surgeons or otologists working together. You have radiation oncologists managing the radiation, and audiologists and physical therapists working to save and restore hearing and balance. There are even facial reanimation experts if the facial nerve is involved. And kind of holding it all together is the patient navigator, who is there to guide the patient through every single step of this complex journey.
And get this, even the surgery itself isn't one size fits all. It's become incredibly specialized. This table shows just a few of the different minimally invasive ways surgeons can get to the tumor. And the choice all depends on things like the tumor's size and, most importantly, the patient's goals. For smaller tumors, they might use an approach that really focuses on preserving hearing. But for a much larger one, they might choose a different route that gives them the best and safest access, even if it means hearing can't be saved. It's a very calculated, personalized decision every single time. And that human element, that support system, is just so important. This is a quote from Jennifer Kelly, who is a patient navigator, and she was also a patient herself. She said, "The most amazing part of my job is to watch a patient's face when I mention that I was a patient too." I mean, wow. Can you imagine the comfort in hearing that from the person who's guiding you? It's just invaluable. So, that's the amazing care available today. But what's next? Where is this all headed? Let's take a look at the research frontier, at the search for even better, less invasive treatments. To find new drugs, you first have to be able to study the tumor in a lab. And the way scientists do that has evolved dramatically. They started with pretty basic mouse models, then got more and more specific. But today, they can actually use what are called patient-derived models, where they take a piece of a patient's own tumor and grow it in the lab. It's like having a perfect replica of the disease to test new treatments on. Each step gets them closer and closer to the real thing. And all this incredible research is unlocking some really clever new strategies. One idea is to basically starve the tumor by cutting off its blood supply with drugs like bevacizumab. Another totally different angle is to look at drugs we already use for other things, like a common blood pressure medicine called losartan, to see if they can fight these tumors too. And then there's the super high-tech approach, using drugs that directly block the specific growth signals that tumor cells need to multiply. But the ultimate goal, the real holy grail of all this research, is gene therapy. And this is no longer science fiction, it's actually happening. A new clinical trial is underway right now, testing a treatment that is designed to go right to the source, to fix the underlying genetic problem that causes the tumor in the first place. And here it is. This is the official trial number. This makes it so real and current. And the goal here is nothing short of revolutionary. They're not just trying to stop the tumor from growing or even shrink it. The hope is that this could potentially restore a patient's hearing.
Which leaves us with this final, really hopeful question. The progress we've seen is just staggering, right? From major surgery to pinpoint radiation to targeted drugs, and now, gene therapy? So the question for the future isn't just if we can treat this tumor, but could we actually be on the verge of treatments that not only stop it in its tracks, but restore everything that was lost? It's an amazing thought.